Emma stared at her phone, her white medical student coat still draped over her desk chair, a stark reminder of the month that had just changed everything. The message from Elle glowed on her screen like an accusation. That witch failed me. My internship is invalidated. At 21, Emma had just completed her mandatory nursing internship, a rite of passage for third-year medical students in France. While other med students treated it as a formality, Emma had thrown herself into learning, her heart pounding with excitement every time she successfully drew blood or inserted a catheter. The month was designed to humble future doctors, to show them the irreplaceable value of nurses who formed the backbone of every hospital. Emma had been paired with Elle, a 23-year-old nursing student whose future hung in the balance. Unlike Emma, who simply needed to show up and observe, Elle faced intense scrutiny. Every procedure, every interaction, every tiny detail would determine whether she could progress in her nursing career or repeat an entire year. From the first day, Emma noticed the tremor in Elle's hands as she prepared injections. She watched Elle's face flush crimson when she stammered through basic procedures, mixing up medical terminology that should have rolled off her tongue effortlessly. Initially, Emma attributed it to first-week jitters. Everyone was nervous during internships, but as days melted into weeks, Emma's concern deepened into something darker. She witnessed Elle drop sterile tubing onto the grimy hospital floor, then attempt to use it anyway until a sharp-eyed nurse intervened. She saw Elle forget to disinfect her hands before handling IV preparations, watched her skip the crucial step of cleaning skin before insulin injections that could mean life or death for diabetic patients. Each mistake sent Emma's heart racing. These weren't small oversights. They were fundamental hygiene violations that could kill patients. Emma found herself holding her breath every time Elle approached a patient, silently praying nothing would go wrong. The nurses tried everything. They pulled Elle aside for gentle corrections, demonstrated procedures multiple times, and offered encouraging smiles even as their eyes betrayed growing worry. Emma watched their patients stretch thin as Elle continued making the same dangerous errors, day after day. At this level, these mistakes shouldn't be happening. Emma overheard one nurse whisper to another, her voice heavy with the weight of a decision no one wanted to make. Emma finished her internship a week before Elle, offering what felt like hollow words of encouragement. "Good luck," she had said, knowing Elle would need more than luck to pass. She thanked the incredible nursing staff who had opened their world to her, left the hospital, and tried to push the nagging worry from her mind. Then came the text that shattered Emma's uneasy peace. Ellie's words poured across the screen in a torrent of rage and denial. The nurse who evaluated her, the same woman who had patiently taught Emma to insert her first IV, who stayed late to ensure every student understood proper protocols, had made the devastating decision to fail Elle's internship. "She's vindictive," Elle typed furiously. "She had it out for me from day one. This isn't fair." Emma's stomach twisted as she read Elle's character assassination of the nurse she remembered as kind, thorough, and genuinely caring about patient safety. This was a woman who had dedicated her life to healing, who worked 14-hour shifts with a smile, who treated medical students with the same respect she gave attending physicians. "She was actually really lovely," Emma typed back, her fingers trembling slightly. She couldn't let this good woman be vilified for doing her job. Well, his response came like a slap. "That witch destroyed my future." Something snapped inside Emma. The weight of watching preventable mistakes, of seeing a dedicated nurse forced to make an impossible choice, of witnessing Elle's complete lack of self-reflection crash down on her. "Maybe you deserve to fail when you made such basic hygiene mistakes," Emma typed, her heart hammering as she hit send. The silence that followed felt deafening. Elle called her an asshole and disappeared, leaving Emma staring at her phone in the quiet of her dorm room. Now Emma sits with the crushing weight of truth and consequences. Elle would have to repeat her year dreams delayed, finances strained, confidence shattered. But somewhere in that hospital, future patients would be safer because one nurse had the courage to say no. What do you think Emma should have done? Was she right to defend the nurse's decision, or should she have supported her fellow student? Share your thoughts in the comments. We want to hear how you would have handled this impossible situation.